Oh, I think I know how to turn it off finally. The subtitles. Never mind. All right. You guys got any infants in your family? Cousins or nephews or cousins or any of that?
That are infants?
Yeah.
Yeah, I have cousins, brothers,
Okay.
nieces and nephews.
This is always fun to go through this stuff because some of the things that they do in their first 3 years, like literally most of the brain development happens right now, early on. So, social change and consequences. Um, Actually, until like 30 years ago, babies, you guys ever heard that like way back when we used to have lots and lots of kids because a lot of them would die? Like the infant mortality rate was really, really high. And that's why a lot of the research didn't focus on, like infant development or like, they were important, but they were more of a burden. You know what I mean? Like you had to keep them alive, you had to have enough food, but ideally they'd eventually take care of you when you got older. So the main development task in infancy was survival, and like um, when we finally got a lot of antibiotics in the 1900s, we had a way higher survival rate than we used to, and that's when the rates decreased. Then we started adding, nutrition studies. So in the 1900s, we had not just like medicine and antibiotics, but like nutrition, learning how to eat properly. We were talking about Nutrition Friday and like how different things that we do help our brain development as a kid. And then even in the womb, it's more important. So, and it says here the 60s, it finally was recognized that poor early childhood development could cause damages further on down the line. So, like anxiety, even depression, even some learning disabilities. So, it's only, it's technically only been like 50, 60 years that we've started being real focused on that. And that's why we created the Head Start program. That was in 1965. So a lot of these federally funded programs, some of the stuff funded from the which we have as social work jobs today. So lots of social work jobs nowadays still use the Head Start funds. And then 30 years later, they created Early Head Start. So that's kind of where even like Help Me Grow and make sure to get this sign-in sheet. Name and then sign in. So the Clinton administration kind of got Early Head Start going, and that was a helpful piece because as mentioned before, there wasn't as much a focus on infants in the past. We were just like, oh, they're kids. As long as you keep them alive until they're an adult, they'll be fine. So, and maybe you have already witnessed with nieces or nephews or cousins or anybody the way development affects them, or like the way you behave to them, they behave back to you, things like that. Anything you want to share about or stuff you've seen?
So for my brother, he's hard headed. So like I'll tell him like, hey, Sean, you was not allowed to do that. So like before I came back, I was like, hey, Sean. And he goes, Tavi. So I'm like, what did I just say? What did I just say? So I was just like,
Yeah, it's raising kids is definitely hard and can be challenging.
I say kids, they do catch on fast. And they know.
Uh-huh. They can tell when there's stress or if the parents are fighting or any of that stuff. Like they pick up on it. So, all right. So social change and consequences for infant. One of the things with societal changes recently, and we've mentioned this before, and I talked about it a lot. Like in the 70s and the 80s, you could get away with like one parent working because inflation wasn't that bad. One and a half maybe. So somebody could have like a part-time job and a full-time job, or maybe dad just worked part-time. But nowadays, things are so expensive with like rent, the cost of living, the cost of food, insurance, um, gas, electric, heating, and water. There's a lot of people that work 2.5 to 3.5 jobs between two of them. So greater number of unmarried women also, and then increased number of teenage mothers and increased substance abuse by mothers. So we've got more drugs kind of out in society, it seems. There used to just be weed and a couple other things. Now there's heroin, and in the 80s, kind of like more crack, cocaine, and a few other things. So we started getting more policies towards childcare. One of them was the Lanham Act provided government support for childcare, and that was during World War II. As you would have had someone gone away fighting in the war, someone else trying to stay home and working, and then the child care for kids. Then in the 70s, we had daycare programs increased, and that might have started with some of the inflation we saw from oil prices and whatnot. So two people needed to work. There was Child Care and Development Fund, the CCDF. There's a few other laws that were passed, Dependent Child Care Credit, and then Welfare Reform Act of the 90s, and that was in Clinton administration also. So infancy stage of human development, though. So like the most important is so like at 2 years, you guys know how much a baby is usually when they're born. I know it's hard to remember all the time. How much a baby weighs when it's born. Right, yeah. So like often they're between 6 and 9 pounds. And so in the first 2 years, a baby like literally triples its size. It goes from like 6 to 12 pounds. Actually, our baby was 6.5, and then now she's already at 18 pounds at about 7 months. So within the first year, you like triple your weight. The physical growth, they start learning how, like right now, she's doing like sitting up and the motor development, learning how to grab things, like they pick things up. They're all like, so they're just like learning life, and there's so many things going on in their brain. It's like things that they're figuring out, and they catch on quick, just like you said. So their motor development, their vocal development's the funniest, because you'll see them like ah da 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 da, just making nonsense words, like babbling and stuff. But they're learning how to talk. So a lot of fast cognitive and social development. The rapid physical growth is the first year. So I think you about triple in size in the first year. Some babies quadruple in size. It depends on what you're feeding them and taking care of them with. And then growth and size depend on the environment and conditions, as well as genetic endowment. So we all pass those genes on to our babies. Like we noticed our baby won't fit in any of her like 6 to 9 month whatevers they are when they have feet on the bottom of them. So we had to cut all the feet off, because for whatever reason, like all the women in my side of the family, like my mom's like shoe size 10 and my sisters are 11, and so we got to cut all the sacks, not have the feet. So everybody has just different things that they pass on, some with the big head, some with the different well, there it is, birth weight doubles in 5 months, so the baby just gets huge. And we can't keep that growth rate up. If we doubled every half a year, we usually kind of like peak out. The length has doubled in a few years. And so some pediatricians say if you measure the kid, I think it's at 2 years, you're half of your adult height. So if you're 3 feet at 2 years old, if you're 3 feet tall, you're probably going to be 6. I always thought it was 3 years, but I guess at 2 years old, you're half your adult height. So if you're 2 feet, 2.5 feet, you'll be like 5. And that's kind of a way to figure out how big they'll grow. Some red flags are if they have too big of a head or too small. And that could be like a cognitive deficit. Small height could be potential genetic syndrome. So they're, again, still looking for, in these first few years, checking for autism, checking for right away in the womb, they can see trisomy 21, which is Down syndrome. The infant brain. You guys ever seen the soft spot on the head of a kid? You ever heard of that? It's like basically because their brain is going to grow. And so the skull doesn't fully close and like fuse until you're a certain age. So the brain growth is most critical to biophysical human development. At 1 year, you're about half the size of an adult brain. So that's why you'll still kind of even have the soft spot in your head as you're like, your brain's moving your skull out, and then eventually it'll fuse. So you got to protect that too. It's like if they get hit, it could be a mess. Billions of neurons. So like everything they see, everything they smell, everything they taste. There's some hilarious stuff with baby stuff. I was going to see if I could send something because there's funny videos I was doing with the baby this weekend. Maybe I have to email it to myself is the trick. So, any questions at this point in time? Here we go. Watch it be too big. But they're just like learning everything so fast. So it's important to get the proper nutrition. Supposedly the formula has a lot of that in it. Breast milk is supposed to have a lot of that in it. But you ever see on like soy milk, it says, do not use this as formula. Because sometimes, it's easy to think like, well, they can, if I drink soy milk, then they can drink soy milk too. But, all right, we'll see if this works. So like omega-3s and fatty acids. So like your brain wants lots and lots of fat, like good fats, omega-3s, omega-6, omega-9s. The experience in the social environment is also important to brain growth during this period. So in like the 70s and 80s, maybe even when you guys grew up, you still could like smoke everywhere. And like, that's a big thing to kind of know to kind of keep away from babies. But in the old days, it didn't matter. Like you could smoke anywhere. People would be like smoking with kids in the car, which I know that they still do, but you see it less and less. Like you'll see all the windows rolled up and the whole car is hot boxed with a baby in the back. And it, you laugh at it, but it does affect brain development. So some states have passed like laws. Yeah.
I have a question.
Uh-huh.
So how you said that when people smoke around a child, it gives them brain development problem. So my question is, some parents that are getting pregnant now, they quote unquote say that their doctor says it's okay for them to smoke weed.
Really?
Because I guess it helps. I can't really get into it because I don't know much.
Right.
But basically, the doctor said it helps deal with it.
They may be going off of the argument saying that like it helps their anxiety. And if there's some type of an anti-anxiety pill, but so the smoke, I don't know about so much. I would say, obviously when there's smoke in the air, there's going to be less oxygen. You want to have as much oxygen as you can. Like, have you guys ever been to oxygen bars too, where you like breathe the oxygen, different flavors, and you almost feel like so good. So you're asking, you don't have a good argument for people that are like, it's all right if I smoke weed.
Like for me personally, I just feel like you shouldn't smoke or drink with a child. And I know in California, if they find any like alcohol or weed in your system, they'll take your child.
Right. Yeah, yeah. So the first poop has 7 months. First baby poop has 7 months of alcohol and drug usage. But did I hear you say their doctor said it was helpful for them to have a weed in their system?
I guess because it's like prescribed.
Right. Yeah. So if it's their anti-anxiety med, I could see maybe in the pill form, taking the pill, or even how there's other stuff, CBD oil. Smoke, I just don't, because like you are the baby's lungs. So like those are the only lungs. I'd have to do more research on that. I feel like I don't know. I apologize. Um, so here is the baby this weekend. She found my hair. She was like,
Hi.
she's like ripping my hair out.
Hi. Can't eat my hair, you silly butt. What are you doing? Are you a hairstylist now?
No.
Then she sees the computer and she's like, let me touch that. Let me, like
Hairstylist.
phone, computer. They want in on anything that you send to them. So she's about 7 months. Now she wants to eat my freaking hair.
Hair. What the heck? That is not styling gel. What the heck are you trying to do? That is not styling gel.
So I had just gotten out of the shower. I'm sure it looked like funny that it was all darker and.
Excuse me, that's my hair. Can't.
So anyway,
Dude.
anything they do is kind of like, any little interaction you have with them is kind of, they're taking it all in, they're just like, they watch us eat, they watch us chew, you know what I mean? Is like eventually they'll want to, right now she just takes a bottle, but we are giving her baby food, but like they watch your mouth and see how to chew. They they almost mimic everything that you do. Now you're making me want to look up the weed question about smoking weed as a, let's see here. Did we use this last time? Oh yeah, paper tigers. All right. So for some reason, this always messes me up. And I will not figure out how to, I lost it again. All right, let's try it. So like weed, that'd be a bad, has short and long-term effects. Short-term effects include lower response to light stimuli. So I guess they have done some research on this. Like not as much as you would expect, but now that marijuana is legal in a lot of states, it's coming up. And sometimes it does help to look at a peer-reviewed study. This one is just parents.com. Well, here's CDC, so the Center for Disease Control. Has the marijuana use in pregnancy. So chemicals, tetrahydrocannabinol. So it's the THC passed through your system to the baby and your baby's development. More research is needed, like I was saying, to better understand. It's recommended you don't use marijuana. There are some like safe anti-anxiety pills that they could take. I don't know the names of them, but I would imagine there's a list that they have. But it shows they did some research. It will give them a low birth weight, so that can be dangerous. Breathing marijuana smoke can be bad for you and your baby. Marijuana smoke has many of the same chemicals as tobacco. and may increase the chances for developmental problems of your baby. And then there's the research studies they cite whenever they have those numbers after it. Some research shows it's hard for your child to pay attention or learn. These issues may only become noticeable as your child grows older, so it can take a while for that to show up. Separate from the direct chemical effects, use of marijuana may affect a mother's ability to be able to properly care for the baby. Chemicals from marijuana can be passed through breast milk, so they even, if you are breastfeeding, they don't want you to drink or smoke again either, because you can pass that on. You can get your baby drunk. THC is stored in fat, so your fat tissues, and is slowly released over time, meaning your baby could still be exposed even after you stop using the marijuana. Sometimes weed can take 6 months to get out of your system, 6 or 7. When I worked at the recovery center, like they would take drug tests and the numbers would keep going down and down and down. But it wasn't all the way out. The longest I saw was like 7 to 10 months. Somebody took, like they've been smoking every day for a few years. Data on the effects of marijuana exposure to your baby, though, are limited and conflicting. To limit potential risk for the infant, breastfeeding mothers should avoid marijuana use. So they have a few studies that have been done. Well, there's at least a couple in the 2000s, but there's some 1990 studies. But it looks like more than likely it's better to stick with, whatever anti-anxiety pill that they recommend. Gosh. All right, here we go. I don't know if that helps answer some of your questions. Will you see them when you go back to California or Vegas? Will you see them when you go back to Vegas or California? Like, well, there are some studies. If you want to look at them, here they are. Or you'd rather not fight with them. They're like, okay, do what you want. But
I don't know, like I can't control nobody.
Right.
But
sometimes giving them the research and the evidence helps, but you're right. I mean, ultimately, it will be their choice. Now, I do know in the state of Ohio, like when we had a couple 16-year-olds at the recovery center, that first baby poop is like thick and tar-like substance. It'll have a record of all the substances the mom has used in the last 7 or 8 months. So, and I guess that's because, your baby probably doesn't start pooping until it is like 1, 2, or 3 months, or like the digestive stuff doesn't get into the gut. But that first poop has everything, and then usually Child Protective Services does get involved there just to make sure the infant is safe. Growth does not happen at the same rate all over, so babies' growth from head to feet is called I can't even pronounce it. And then from spine to the extremities is called proximodocital. So they usually measure like how big the head is, the length, and then I guess the weight too. And then one last one about maturational theory is genetically programmed sequence. So different things that the baby goes through in that sequence. And the milestones, so some of them, this is why they give you percentiles. You guys remember getting those growing up? The doctor would be like, you're in the 50th percentile, and you're in the 60th percentile. They're doing it to check for anything bad. And so those at the 50th for their age, that would be okay. But if they are seeing babies measure at below 50, that's when they may look further. Some other things to look for: does not take into account the quality of clinical experience needed, the station posture in sitting and standing, the gait and movement. So the doctors look at all these different things. Like when we take her in, they ask, like, is she eating food? Now they want her to eat 3 meals a day, at least try to get like 1 bite in, along with the bottle. It helps us to identify those who may be at risk for a developmental delay. That's not necessarily a developmental disorder. So I think, yeah, you take the baby in at 9 months, 18 months, and 24 months. And that's when they can find some of those things out. Now, here's a list, and this is always helpful to see. I was wondering when she was going to be able to crawl, and I guess it's 10 months. So involves large muscle. The gross motor skills are their large muscles, and they need to practice them. So reflexes all disappear by age 6 months, like some of those reflexes we were showing you guys. They can turn their head at 1 month. At 4 months, they can roll from front to back. Actually, right now, she'll roll across the room, and she can't crawl, but she'll roll as far as you let her roll. 7 months, they can sit up without support. So I guess we're right at 7 months. 10 months, the creeping well, cruising around furniture, mostly crawling. So being able to crawl a little bit. 12 months, they can take their first independent steps. But at 14 is when they'll be able to stand without pulling up, or they can walk well. So it's almost a year and a half till they walk backwards. Like, it's hard to learn how to walk backwards in the first place. And at 22 months, they can kick a ball if you show them. So again, you're showing them everything to do. And then at 2 years, a child can kick a ball, jump with 2 feet off the ground, off the floor, and then throw a big ball overhead. So kind of like that. And then they have some red flags is if at 9 months they can't sit. And then at 18 months, if they can't walk. Those are like your red flags. And here's a chart of what it would look like. So the chronological progression of motor skills. So again, just kind of like sitting, being able to turn their head, kind of lifting themselves up. They roll over at the 5 months. Sit up at 6 and 7, really. That's the big one. Then being able to pull themselves up at like 8, crawling maybe by 9 and 10, and then walking at around 11 and 12. And it's different for every single baby. But this is kind of a good chart to follow that if you carry your baby around a lot, it's easy to find, that they'll let you carry them around and not do the stuff that they will, check out. Now, fine motor, this is a little difficult. Like being able to grab stuff, like pick up small objects. So at 2 months, they can hold the rattle, but you have to put it in their hand. At 3, they'll like knock stuff, like batting around, batting objects. 5, reaching and grasping objects. So, like they'll like to get little things to learn that fine motor skill. In 6 months, they can like pass it from hand to hand, like over that way. 9, they like to bang stuff. They like to make a lot of noise. And throwing things at like 11. And then 12 is that pincer grasp. So like you put berries on their plate to eat and like, real small, fine things. 14 imitates back and forth scribble. And then they could build like a 3-cube tower. At 20, adjusting a spoon for eating. And then at 22 months, they close the box with a lid and then also imitate a vertical line. And then the last one they kind of go through is at 2 years, a child can create a 6-block tower, feed themselves with a fork and or a spoon. And then they can even remove clothing. They always throw their socks off and then grasp and turn a doorknob. So that's kind of the details on those. Now, the other part they assess is the nervous system. And that's like, a lot of times they'll look at their sleep-wake patterns, like how long they sleep for. Also, their active sleep. As periods between, with eye movement. So like REM, when you're sleeping, you can see like the eyelids moving with rapid eye movement. Quiet sleep is periods with no eye movement. Unstable sleep patterns have been observed in many types of atypical brain development. And then also early sleep patterns have predicted subsequent developmental outcomes. Like they can tell based on how much they sleep, how their development can go further on into the future. Some of the questions I had is how can we tell whether a baby is developmentally delayed? And then following ages and stages questionnaires. So they can predict autism at an early age, like if the baby kind of has no interest in playing with you. Do any of you guys have nieces or nephews or cousins that are autistic? How would you describe their behaviors?
He doesn't like to talk.
How old is he now?
He just turned 4.
Okay. So he must have only been diagnosed like 2 years ago or 3 years ago.
I think so.
Okay. Because you can't tell right away at birth. You're like, that's a healthy baby, you know, but then sometimes, so it used to be 1 in 100 babies would get more like 1 in 1,000. And for whatever reason, if it's diet or poisons in the food or water, like we're having 1 in 100 and 1 in 60 babies diagnosed with autism. And they still don't have an exact reason why, you know, like a diagnosis pattern why. So, the mental health is another one. So again, this is going to be dependent on the parents a lot of times. So this field promotes healthy societal and emotional development, the mental health part, from 0 to 3 diagnosis classification task force was started with the Clinton administration again. I feel like a lot of stuff came up in the mid 90s. And this task force defined infant mental health as developing the capacity from birth to 3 as you need to experience, regulate, and express emotions, be able to talk about them even, form close, secure interpersonal relationships, and then explore environment and learn in the context of the family, community, and cultural expectations of young children. So, and that again is different from community to community, but making sure to keep an eye on it. So, infants are vulnerable to abuse and neglect, and that's part of what the next big assignment. So, there'll be discussion boards on this, but I'm going to show Paper Tigers, the movie, in class in the next couple of weeks. It's only about an hour and 40 minutes. But you all can watch. Does anybody here have Amazon Prime? You guys ever get Amazon? It's free on Amazon. Like you can watch it. If you don't have Amazon, you can come into class and watch it. We'll show it in the next few weeks for that assignment due in March. So yeah, vulnerable to abuse and neglect, that's a big one. And that's where, as social workers, sometimes Child Protective Services get involved. They may withdraw from interactions and even seem to suffer from depression. Infants can also develop problems with feeding, sleeping, and behavioral regulation. So you could even see it with their diet, and they might not gain weight properly. So some of the problems in infant-parent relationship could be due to a previous pregnancy loss, postpartum depression, infants' medical development problems, the parent's drug use, abuse of an infant, prolonged separations, family stress, parents' mental illness, or a parent with their own longstanding attachment disorder. And we will get into attachments in the next couple of chapters, like a healthy attachment, a secure attachment, and then an insecure attachment. So, as a social worker, there are some assessments, like you can look these up online and give to kids at a young age. So the AIMS is one of them. It's an instrument for assessing emotional well-being of children from birth to 5 years. And then they look at attachment with the mastery and interactions with social support. And then as social workers, we'll be expected to develop interventions for emotional development. So, or teach the parents how to do this. So like show admiration for the baby in the parent's presence, point out the parent's ability to hear the baby, child's cries, request, and respond appropriately. Like it takes a while, but you can learn what the baby is asking. If it's a tired cry, if it's a hungry cry, if it's a I got a poopy diaper cry or a wet diaper, and when those needs are met, they generally stop the crying. Unless if it is like a colicky indigestion type of thing. So, like basic needs and meeting the basic needs and giving them support. Also, discussing the role of the other parent in caregiving. So sometimes there's a parent who can stay with them, and sometimes there's a parent who works. Sometimes both parents work, and that becomes a little harder. But childcare sometimes fills in the gap there. Have any of you guys worked in a childcare before? That's like a job you can get quickly out of high school as long as you pass like all the background checks. So they have different things that you have to do to make it to get the licensure for childcare. You also discuss the upcoming stages of infant development with the parents, like things that they might need to get ready for. Comment on how proud parent must be to see the baby and child doing so well. So again, as a social worker, giving that support, letting them know it's not easy, and there are going to be things that you'll have to learn. Um, and then I kind of wanted to show you guys the trailer of um, Paper Tigers again before we got finished here. So let me get to that. And then next time we'll start on the early intervention for developmental delay. Because in the past, they really did just, if you had a baby that was diagnosed with MR or below a 70 IQ or even autism, they'd be like, all right, send them to the institution. And like some countries still do that. They just like, they tell the parents to send them away. More recently, though, we've found different support and services to work with that. And we'll talk about that the next time. So here is the Paper Tigers movie, which I was getting for you guys. And then, let's see here, not this tab, it's this tab. I know I already showed the trailer last class, but I wanted to, this will be the one that we'll be watching in class. If you have Amazon Prime, you can watch it yourself. Oh, shoot. You're not able to see it, sorry. So let me drag that over again. Yay. All right. Here's the trailer, too. I know we've seen this before last week, but I just wanted to get
Walking down every street in America, there are the kids that get labeled, get rid of them, they're nothing but trouble. I think it sits right in the heart of the most assaults, gang activity, truck sake.
I didn't hear that this is the worst school you could ever go to.
Kids at night, the fights, absolute chaos. Because we all went to a chair and said, oh, I was gonna kill them. All of them were bent down.
I was invited to go to a conference about complex trauma and what stress does to the brain.
The behavior isn't the kid. The behavior is a symptom of what's going on in their life.
My mom was away, and Shelly. She's the only thing I had. And for her to abandon me like that.
His coping mechanism was drinking a ton, smoking a ton.
I remember one night, I didn't want to be alive.
It hit me, and it hit me really hard.
You have to unconditionally love them, and you have to believe that their behavior might be out of their control.
I love playing guitar with several of these guys. Feel like that's almost as strong as anything we've ever done in class.
After that, he wasn't only a disappointing figure, he was a friend.
Watch their confidence come back has been incredible.
I'm not by myself anymore. I got a team.
I can do it. All of you can definitely do it.
It's not that I'm judging you. I know why you're smoking weed. I know why you smoke that. I know why you're fighting. You don't want to feel. I mean, that's the big challenge is I'm asking you to try feeling for a little bit because sometimes when you feel, it guides you in the direction that you should be going, not to where you are.
So there's been a lot of research in the past several years, about 21, 22, on trauma-informed care, and it's like a special branch of social work that they've had extra funding towards. And the trauma-informed care area is showing that the damage that can be done, and then also furthermore, the interventions that can be done to reverse those. So yes, child neglect and child trauma from abuse and things do have a detriment to brain development and spiked cortisol and how your brain goes throughout the year. But with therapy can be undone and you can kind of get back into normal society again with proper interventions. So getting in this development, we're already at birth and early childhood. That's when you do want to catch it and make sure everyone has a safe space. So that's the movie we'll be kind of getting into this week and next. So, and if it looks exciting to you and you have Amazon Prime, it's free. You can watch it now. But do you guys have any questions about anything? That's like the next big project. So like the paper due in March, but we'll watch the movie first and then go from there. So see if I